Welcome back. In this video, we'll continue our discussion about the progression of dementia. Dementia is a progressive and often unpredictable disease. Symptoms can remain stable for a while and then get worse unexpectedly. This sudden decline may be due to the progression of the disease itself, or it could indicate an underlying medical problem. There are specific triggers that can worsen dementia symptoms, and we'll look at the most common ones in this video. Before we begin, remember to hit the subscribe button and give us a thumbs up if you're ready to explore with us. All right, let's get started. Number 1. Infections. Infections are a common cause of delirium, a sudden onset of confusion, and they can lead to both short-term and long-term cognitive impairments. For people already showing early signs of dementia, infections can accelerate or reveal underlying cognitive issues. People with dementia are particularly vulnerable to infections such as pneumonia and urinary tract infections, UTIs. Long-term studies have shown that hospitalization for common infections, such as pneumonia and urinary tract infections, is associated with a 1.4-fold increased risk of developing dementia in older adults who are otherwise healthy. How infections lead to delirium. In younger, healthy adults, the immune system quickly responds to infections, often clearing them out rapidly. However, as people age, the immune response may weaken, resulting in a slower initial response and a delayed, exaggerated inflammatory response. This inflammation can impair brain function because communication between immune cells and neural cells is essential for cognitive health. Inflammation disrupts this communication, leading to cognitive impairment and potentially delirium. Individuals with dementia, as well as those with early, subtle symptoms of cognitive decline, are at a particularly high risk for delirium. In fact, sudden delirium can often be one of the first signs of an infection in someone with dementia. Recent research indicates that immune system changes seen in infection-related delirium mirror those that contribute to neuronal damage in Alzheimer's disease. This infection-related brain inflammation can accelerate underlying processes of cognitive decline, potentially explaining why infections speed up cognitive deterioration in individuals, whether or not they have obvious symptoms. Preventing infection-related delirium. Preventing infections can help minimize the risk of infection-related cognitive decline. Supporting immune health through regular exercise, a balanced diet, vaccinations, and good hygiene are key preventative steps. Because delirium can sometimes resemble dementia, it's crucial to consult a doctor at any signs of infection or illness to address potential causes of sudden cognitive changes. Number 2. Stroke or brain injury. A brain injury, whether from a fall or stroke, can worsen dementia symptoms or increase the risk of developing dementia. Strokes can exacerbate dementia symptoms by damaging brain regions that were previously unaffected. For instance, someone with dementia who previously struggled only with memory may experience new challenges with speech or movement following a stroke. Strokes are particularly common in vascular dementia and may cause a stepwise decline, where the person's abilities noticeably worsen after each event. Each stroke inflicts additional brain damage, leading to further cognitive impairment. Moderate to severe traumatic brain injuries, TBIs, can trigger a sudden worsening of dementia symptoms, either immediately or years later. Studies also show that older adults with a history of moderate traumatic brain injuries have a 2.3 times higher risk of developing Alzheimer's disease than those without such injuries. Signs of a stroke to look out for include sudden confusion, difficulty speaking or understanding speech, weakness or paralysis on one side of the face or body, sudden loss of balance or coordination, sudden vision loss, severe headache without known cause. Sudden changes in dementia symptoms due to stroke or brain injury require immediate medical attention. If you or someone you know shows these signs, see a doctor immediately to prevent further brain damage. Number 3. Medical procedures or medications. Anesthesia or the physical stress of a medical procedure can trigger delirium. In some cases, this state of confusion can last even after the person has been discharged from hospital. Medication side effects account for about 39% of delirium cases. Delirium can also occur when someone starts or stops a medication, so a recent change in medication is a possible cause. To treat delirium related to medical procedures or medications, doctors focus on treating the underlying cause. This may involve adjusting anesthetic methods or changing a person's medication. Providing a thorough medical history is essential to help doctors take preventive steps against delirium. Number 4. Changes in routine. People with dementia often find comfort in their daily routines, which provide a sense of predictability and stability. A sudden change in routine can disrupt this balance, sometimes worsening dementia symptoms, especially if accompanied by stress. Some common changes that may trigger symptom escalation include moving to an assisted living facility or nursing home, relocating to live with family or leaving the family home, being hospitalized, having new caregivers. These changes can be challenging, so maintaining consistency whenever possible is helpful for easing transitions. Number 5. Rapidly progressing dementia. Rapidly progressing dementia advances much faster than common forms of dementia like Alzheimer's disease. This accelerated decline is often due to an underlying condition, such as prion disease, an autoimmune disorder affecting the brain, infection, or cancer. Since some of these conditions may be treatable, it's crucial for doctors to investigate potential underlying causes to see if any interventions could slow or halt the progression of this type of dementia. What to do if dementia symptoms suddenly worsen. If a person with dementia experiences new or worsening symptoms, don't assume it's typical or untreatable. Contact a doctor as soon as possible. If the person can communicate their symptoms, ask about what they're experiencing. Some steps that can help with diagnosis include keeping a record of all new symptoms and when they occur, informing the doctor about any recent changes, such as a move to assisted living facility, noticing any bruises or visible signs of injury. This concludes the second part of our dementia progression series. If you missed the first part, it's available on this channel. Please feel free to leave questions or comments below, and if you found this video helpful, we'd appreciate a like and subscribe. Thank you for watching.